Good morning, everybody. Welcome to the first installment of Leadership Rounds, where, as Lindsay said, I'll sit down with leaders shaping healthcare policy and beyond, hopefully on a monthly basis, maybe every other month. Thank you all for joining us for this first one. We're going to talk a little bit about policy, but probably even more about leadership with folks that are leaders in their field and have made or are making a significant impact on the policy landscape in Georgia. So it's only fitting that our first guest is GHA's current board chair, the CEO of Phoebe Putney Health System, Mr. Scott Steiner. Scott, thank you for joining me.
Good morning. Thank you.
Scott has worked in healthcare for nearly 35 years and is a stalwart champion of patient safety. He's the architect of the Phoebe Focus, a strategic effort to deliver on capital improvements to transform the delivery of healthcare in Southwest Georgia. And the rest, I'm going to let him tell you about. So we're going to jump right in. We're planning just 45 minutes of conversation. Scott, thanks for being my brave first guest. Give us the 2 to 4 minute kind of elevator pitch, who you are, how you got where you are, a little bit about your career progression, how you ended up in Phoebe.
Well, good morning. Thank you, Caylee. Appreciate the opportunity. I figure these can only get better from here. So, it's healthcare. Everybody's got a different path to how they got in the position they're in today. For me, I was definitely influenced by my parents. My dad was always in management and usually the printing industry, but my mom was a nurse, a little bit later in life nurse. She got her degree when she was in her 40s and was an ICU nurse. And I remember she always talked about how much she loved her patients and how it was a blessing for her to care for people at the most vulnerable time in their life. And I think that always had an impact. And I went to college and got my master's degree and decided to do an emphasis in health services management. One of my first instructors, a guy named Greg Zeller, was a chief operating officer at a big hospital in St. Louis, and his style of teaching was to come in and talk about his day, and I always thought how fascinating to sound, and I thought, now I want to be a chief operating officer of a hospital. And so was able to get in and start at a hospital. I did an internship back then, way back. These were free internships, but did that for a summer and at a little hospital in East St. Louis, Illinois, just across the Mississippi River. They hired me after that internship and progressed from there to work for a BJC health system in St. Louis, back to St. Mary's, which was a small hospital owned by an order of nuns. And they really had nothing. We had a couple pennies, but we made magic happen with virtually no money in a very poor community. And I think that's really where I developed a lot of empathy for healthcare, but then had the opportunity to go to Chicago and work for Tenet Healthcare. So I went from this order of very, generous, peaceful, though very smart and business astute order of nuns to Tenet, and it was very different, but still a lot of great people, and was the chief operating officer for a hospital in Chicago for 10 years. Tenet asked me to go to Detroit and run 4 hospitals for them there in the city of Detroit, and I did that, and then I've been at Phoebe Putney here in Southwest Georgia for almost 7 years, and each one of those stops was great. I never forgot what my mom had taught me, which was that, it is such a privilege to care for people at a very vulnerable time in their life. And we've got choices in how we do that. And I think ultimately what Tenet taught me a lot, but Tenet also taught me a lot on what I'd never want to do again as well. And I've got that ability to do that today here at Phoebe. And while it's not perfect and there's certainly challenges for all of us in our careers and in healthcare in general. It is an exciting time to be in healthcare, to be in and to do this work. And everybody is not made to do it. But I know the 92 people that are all unconnected right now. For them, they absolutely are. This isn't for the weak or the meek, but it's awesome.
We were joking earlier, and you and I have talked in previous conversations offline about the type of work that we like to do, like what your strengths are, the types of jobs that you look for. You were joking that no one wants to hear kind of your biggest leadership lesson, but I think they do. Tell me a little bit about what your calling card is, like the way that you do your work, and then what some of those, maybe the management or leadership skills where you know that you have to augment with your staff, or something that you know you have to work at?
Yeah, I think for me, that's developed right throughout my career with my mentors. I kind of call them my parents, my first ones to develop that core. I got to see my dad. He took me into work every Saturday when he would go into his printing company and just observe how he went about his life. And I've had those many mentors in healthcare, and even to today. So I've learned, and I think that's how I've developed my style. And I've talked about each one of those mentors, what they've given me, but they've also provided me a view of, that's not me. And so I won't be them. I need to be me. So I think my style is sometimes all over the board. I can be very programmatic. I can be very bottom line oriented, and I don't necessarily mean dollars bottom line, but that if we say we're going to do something, we do it, and if we don't do it, like we said, that we say, hey, here's why we didn't. And so that honesty, that corporate honesty is such a big piece. I can't stand to this day. I can't stand a liar. My two daughters would tell you if they wanted to make me mad, they could tell a lie, no matter how small it was. It just bugged me. It still does. And so having that integrity as an individual and as an organization that I represent is how I lead. And I expect that out of myself. I expect that out of the leaders here, our administrative teams, and we get results because if there's one thing I was taught throughout my career is a lot of people have a lot of great ideas, but only few can really execute on those ideas. And I see myself as one of those. Is when we agree to do something, we're going to get at it.
I'm going to switch gears. No secret that you have a little bit of a history with the COVID-19 pandemic. At one point, I think Albany, Georgia was top 5 in the highest rate of new cases per capita in the world. It was Wuhan, New York, Italy, Albany, Georgia. And you were very new in your role, about a year into being CEO, if I'm not mistaken, down there when the pandemic really hit. How did you, there was no playbook. We certainly have some shared experience in that. How did you manage that? I mean, you were thrown in the mix of one of the country's first hotspots, ending up on CNN on more than one occasion. Like, how did you handle that, both from an operational, what are we doing, and then also at the same time managing external kind of communications and expectations of how you were responding and working with the community?
Yeah, I'd been here a year when COVID hit, almost to the date, and some days it seems like just like a week ago, and some days it seems literally like 20 years ago. I think, and to think about it, it was such an interesting time. It was devastating for our community. It was scary for almost everyone, and including me. But I felt like, well, part of my job was you better hide that at least initially, and so I think that the role, there's no intentionality, right? It was my first 100-year pandemic, and it was everybody. So we were all kind of learning on the fly. We were trying to talk to each other. We were talking to a hospital in Washington State who was earlier than we were, and we were trying to get best lessons from what was happening. And I really saw my role as not getting in the way of the many operators that we had, but into really supporting them. And so I didn't take the head seat at the table. I let the hospital operators that we have take that to deal with the influx of the patients that we had, to dealing with that in time. And I tried to take a support role in how we can support. I could support them. Do we have the resources to try to think a few days ahead of time, a week ahead, a month ahead? As we started thinking about the data, and two things stick out in my mind as kind of points that I remember having too much thought about. And when when I think too much as opposed to I should be leading from my heart, and I start thinking too much, I get a little bit frozen. And the one was masks. And when we realized we were cranking through so much PPE, and what our suppliers basically said, we don't have any they literally said, quit calling us. And this is the biggest health medical suppliers in the world. And one of my operators said, we have a ton of surgical draping we had our own laundry at the time, and we weren't using reusable surgical draping. We were using, of course, disposable, but they had just these bins full of it. And they said, maybe we could sew our own masks, put those over the N95s. And as a caregiver came out, we could put those in a hamper and then reuse those and preserve the N95. And he said, we could start sewing those. We have teams. And I remember looking at him, this was on a Saturday, and I'm in my mind, I thought, are you crazy? I am so going to get fired if this gets out that we are sewing our own masks. And I just listened, and we moved on. And the next day he brought that in again. And I thought, all right, there's people that need something to do. So they started doing this, Caylee. And we ended up sewing more than 80,000 of our own masks. We had Singer heard about it and sent us 15 commercial grade sewing machines, no charge, didn't even ask. Just one day they said, hey, did y'all order some sewing machines? And we had all of our teams that were in medical records and in billing who weren't doing anything. They were sewing masks. And let me tell you how excited they were to participate. Right. And that's when I saw, wow, this human element. And we had more than 20,000 people send us masks that they saw our story, and they sent it via mail. And so, it's those stories that I remember. And I think the other big piece was the data is we realized that we needed to share our data, the good, the bad, and the ugly, because while there was this thought of why is Albany first, what we knew is it could be powerful because this virus was going to come to everybody. And the more data we could send out, the better. And so we began to send out it started as just our board members and some city officials. So we had more than 300 people on a distribution list of our numbers on a daily basis, how many had COVID, suspected of COVID, how many died, how many tested. And so having that transparency, I was very nervous about it. But it showed, right? I just have to let people, the smart people, do the job, be themselves, and everything will be okay. And I think during COVID, that's really where I tried to be, is how can I support all these super smart people and these caregivers versus me trying to direct and, feeling like I owned everything.
I think there's so many lessons in COVID. I joke about, well, maybe joke, I don't know, writing a book one day about the lessons learned from working through COVID, and there'll probably be a whole chapter on Albany, but I think y'all certainly started that wave of volunteerism, and folks really I remember that vividly when y'all started the masks. And Phoebe North, when we opened Phoebe North, in fact, is when I realized how much a striker bed costs when we were doing that. So thank you for that education as well.
Well, and you pointed out, right, what I'm so proud of is as a healthcare community, everybody was really nervous at first and thought we could somehow prevent it from coming to our communities. That wasn't going to happen. But then we all pulled together, and it was just not even the hospital community, but our communities and the state, Caylee, and your role that you were in, the governor. I mean, I don't think there was one time we called and said, hey, we need help. And you didn't say, all right, we're there right now. And at one point we ran out of the agent to paralyze someone so we could intubate them. And the department, y'all and the governor flew it down on a helicopter. So we didn't have to intubate people without that medication. So man, those are the pieces that made me so proud to be able to participate, not only our team here, but from a state perspective.
It was a cool experience. I mean, lots of good lessons in the aftermath once we get over the PTSD of it, but lots of good leadership lessons.
That's right.
I believe in a philosophy of daily non-negotiables, things that have to happen in my life daily or almost daily for Caylee to function well, for Caylee to be congruent with who she is. what are your non-negotiables? What happens in Scott's life every day to make you good as a CEO, as a father, as a husband? Like, what are your non-negotiables?
Yeah, I mentioned it, just honesty and integrity. That's for me, for my family, for my team. It to me it starts right there. Yep.
What about from an action standpoint? Are there things that you do? Is it a daily check-in with your team? Do you walk the halls? Mine is physical fitness. If I don't get to the gym or move, it's movement. If I don't move, almost things aren't working well.
Yeah. Yeah. I sure wish mine was physical fitness, but I can sure let that one go in the morning. So yeah, we are social beings, and what I like to do is make the rounds, go in, hey, good morning, how's it going? Anything hot going on? I like to communicate, to over communicate. I pay attention to, I think one of the things I need to do better on that list is to communicate better with my board. And we have 6 boards here at Phoebe, and I'm on every one of them. And just the way the structure is, I need to do a better job of communicating to my board members. But that's, to me, where I don't necessarily walk the halls, but there isn't a single time I don't walk the halls or go to the doctor's lounge or go inside of the surgical suite that I don't walk out thinking, golly, I need to do that more. So, I mean, I think there's always a lesson in that for me, but my non-negotiables are, just try to have a touch base with my team to make sure they know, one, I'm here, and I'm always available, right? We don't have to wait for any formal sort of one-on-one sessions.
Let's talk a little bit about healthcare landscape, challenges, how you're planning for the future. I mean, obviously we could talk all day about challenges in healthcare, but through all that, I always look for the opportunity. What do you see being, not all the challenges, but maybe the single greatest threat to hospitals? And then how are you looking towards the future in terms of where you see opportunities for healthcare and hospitals in general, and maybe even more specifically, if you want to talk about for Phoebe?
Yeah. Oh, we're paid to stack our, to make a list of our challenges, right? Mm-hmm. And so they're far and it's deep. I think that, at Phoebe, I get an opportunity to oversee a system of, a large, acute, somewhat tertiary care entity here in Albany. We've got a mid-size, small and mid-size hospital in Sumter County. We got a critical access hospital in Worth County. We run a bunch of, clinics and urgent care centers, hospice. So I'm blessed to be able to kind of dip my toe into each one of those. And each of them have their own set of challenges. And our colleagues from around the state and that are in critical access hospitals are communities that are not growing. And Southwest Georgia is just that. We are not growing, and that's got its own set of challenges that you're not going to make it up in volume when your community's not growing from a population standpoint. But I tend to think, where I'm spending a lot of my time is in certainly workforce, in trying to extract the premium dollars that we're paying in contract labor, whether it's on a nursing or sort of a support side like that, or quite frankly the emerging world of physician locums. It used to be not many physicians did locums work, and now it's of course a whole industry. And so how do we get more nurses that want to be part of our community? How do we get more doctors? How do we get more phlebotomists? How do we get more accountants, right? I mean, trying to find a darn accountant in Southwest Georgia is tough. But all my colleagues have those same challenges. So to me, workforce is a huge one, and we need to be innovative. And so I think Georgia Strong and Georgia Aid, Caylee, you've been involved in that, but certainly the GHA support, that is huge. I think that can change our communities. I think the Georgia Heart Program, right, for our rural hospitals has kept many hospitals afloat and has allowed others to invest in technologies and services that their communities otherwise would not have. So, I mean, there's a lot of great innovative programs happening. I think the other that is, our constant work on quality and patient safety. I believe our industry is as safe as it has ever been before. Even though we know we're not perfect and we never will be. I was talking to a group this morning. We've got 6,000 employees here at Phoebe. So we've got 6,000 human beings that we are all inclined to make mistakes. We're not robotic. We're not perfect. But we're in a high risk industry, and so that focus on quality and patient safety, and that kind of leads my brain to the regulatory or the litigation and that environment. And we saw some work that y'all did on tort reform, and I'd like to say it was a good start. We'll see what kind of appetite there is to do more. But every dollar that we pay in a jackpot claim or a lawsuit or a settlement, because we are so afraid of a big one, is a dollar that we have diverted away from our community and from investing in a new service or a new piece of equipment or a raise for our teams. And so, I hope that we'll continue to work on that as a state. But, to me, we've got so many, that list of opportunities is long, but I tend to think about, workforce, quality, safety, and then litigation.
What are you excited about this year as your term as chair? At the end of this year, what are you hopeful to say about your term as chair?
I'd like to think, you're right, that we are only as strong as we are together. And it is hard to go in and talk about tort reform to our elected officials, which I don't know, is it 30 or 40% are attorneys themselves, and many of which are, some of them are plaintiff attorneys or have colleagues that are and count on that to support their families. And so if we're fractured as a unit, if the GHA is fractured in whatever way, whether it's public or whether we do it privately, that weakens all of our position as an industry. And it allows people to continue to drive that fracture, whether it's pharmaceuticals, whether it's insurance companies who don't have the same interest in serving our communities, or pharmaceutical companies that want to do away with 340B pricing. And so to me, what I'd like to make sure is that that our team, that our group, that the GHA, we feel that unity, that strength together, and that we can have disagreements and try to understand when we all may not agree on every policy or every bill, but know that maybe it doesn't impact us as a rural hospital, but it impacts our urban hospitals or vice versa, and that we need to support it and we need to pay attention to it and we need to throw our weight behind it, even though we might not get a lot out of it. It supports our industry across the state. So, that's kind of cheesy. I want us to have more unity, but,
Matters. It matters. Thank you. Let's go back to you and leadership for a minute. What would you tell folks watching that are not the CEO yet, but have aspirations or up and coming through their systems or healthcare? What would your advice be to folks?
Yeah, you've got to, I always wanted to be a COO. And when I was, I loved it. And I still say I'm a much better COO than I am a CEO. I was kind of forced into being the CEO, and at first I didn't love it. And so if you want to be, if that's your goal, you've got to be persistent. You've got to take chances. You've got to do the uncomfortable. Because like I said, not everybody's meant to do it. And you've got to have thick skin. You've got to take criticism. These days there's threats that come with it, and how do you deal with it? And how do you succeed in an environment that is chaotic? And how do you lead in that environment in a way that can still inspire? right? And that's how I always feel like I wanted to do, was to, and no matter what role it was or what title it was to inspire my team. And that's not just my leadership team, but all caregivers, right? Is how do I inspire them? And sometimes that's staying out of their damn way. But I think if people are on that journey, you got to stick with it. You got to know, as hard as today was, if there's one thing Tenet taught me, man, I had to do some awful things. But what I did learn was the sun will come out tomorrow, and we got another crack at it tomorrow. That we're resilient. We are resilient people. We're a resilient industry, and I wouldn't do anything different. The journey is it's not this. We all envision our careers being this, like a plane taking off, and it's rarely ever like that. There's some turbulence coming, and it's just, how do you deal with it?
Anything you would tell Scott 10 years ago, if you could go back and have a conversation with you from 10 or 15 years ago, any advice you'd give yourself?
Yeah, I think it's probably like everyone. It's smell the roses once in a while. I think all of our brains are, when you fix a problem, or when you're on to the next one, and you don't take sometimes just even a moment to say, that was pretty darn cool. What we just did there, and what we just did there is going to serve our team and going to serve our community for 50 years or 100 years. We get to, well, what's the next problem, right? And how are we going to fix that one? So I think it's enjoy the ride, soak it in, because even in those tough times, and I give Tenet a little bit of some trouble, but there were a lot of good times there, but our brains are sometimes programmed to remember just the bad times and the rough times. So smell the roses more.
All right, last question for me. What are you reading right now? Any good books on your nightstand?
Oh, what am I reading right now? Well, I tell you, I don't read a whole lot of books. I love Apple News, but I am listening to. I just started the Let 'Em.
Oh yeah.
Yeah. So I'm trying to think of her name, the author's name. She was just on the Today Show or something. But and I'm about 3-4 chapters into that, where you can't. And I think there's such a lesson in there for me and for everyone, which we always try to control the situation and control the reaction of others, and whether it be our children or our spouses or our community members or our board members, and the criticism is just going to come. If you say, hey, I'm going to give everybody $100, give everybody $100 bill, somebody's going to criticize you that it wasn't 520s. And so that's what I'm trying to, with the Let 'Em, is trying to get past that. Now I have to tell you that right now I'm still in I've got, instead of let them and then let me, that's the concept. I still have let them go to hell. But I'm working on that second phase of it. I'm enjoying it so far. I'm hopeful that I can let people let them more than I am today.
Parting thoughts from you, and any words of wisdom, lessons learned. I always say, do good, be happy, go do great things. Parting thoughts from Scott Steiner for our brave first round of viewers.
Yeah. Hey, just thanks for the opportunity. The people that tuned in today probably didn't learn a whole lot, but I just want to, my parting words are thank you. The hospital people, healthcare people, they have such big hearts. And if you're on the call today, sometimes people don't want to, we're in leadership. You're not supposed to have a heart, right? But we all do. And it affects us all. The good times, the tough times, the challenging times, the beautiful times. I just thank you for doing it. Thank you for taking care of people at the most vulnerable time of their life. We will all be patients in our institutions. If we haven't been already, we will be again. And that's who I want caring for me, is someone that has a big heart, that isn't always worried about returning for the shareholders or profit. I want them to run a smart business. but I want them to care for me because I'm scared. I'm worried, and I just need someone to tell me it's going to be okay. And that's what I hope we do each and every day. And I thank the folks on the call today for doing that.
Hear, hear. I thank you not only for your service as our chair, but also the work that you've done in Southwest Georgia, but also across the state. You're an appointed member of several different important study commissions and commissions around the state looking at workforce and other opportunities. You've been a great partner for so many folks trying to advance technical education and other things. And we appreciate you. Certainly the team at GHA appreciates you. So thank you for what you do and for being my first guest on Leadership Rounds. For everyone listening in, I'm excited to announce that we already have our second guest lined up for, I think, October 29th. We'll send out the date confirming that. But end of October, Chris Clark, the president and CEO of the Georgia Chamber of Commerce, will be our next guest to talk about his leadership experience and all the happenings going on around Georgia. So until then, thank you all very much. Scott, thank you again. Thanks for all you do. Have a great day, everyone. Thanks.